Hey everyone, it's Reena from Health Boot Camps and Live Longer here with Dr. Brian Mowll. Dr. Mowll, we have a question that came in, which is what are the symptoms of someone who may be getting diabetes or has diabetes? And especially, what are those symptoms that you can catch really early so you can start to make those changes before you end up on insulin?
Right. This is a great question, and I'm going to answer this in two ways. There are the classic symptoms of diabetes, which you'll oftentimes see in a flyer or hanging in your doctor's office, or you'll read online. And these are mainly symptoms not of diabetes, but of hyperglycemia. They're signs of very, very high blood sugar. And that is oftentimes associated with diabetes, but not always. So typically we're going to see these signs and symptoms show up when somebody's blood sugar is maybe greater than 200, whereas a normal blood sugar is in the 80s. So those can be things like excessive thirst. So you become very, very thirsty, or excessive urination. You have to go to the bathroom maybe every hour. It seems like you're constantly running off to urinate. uh, Feeling dizzy or lightheaded. These are signs of very, very high blood sugar. And you may actually even have a acetone breath, which people who have out of control blood sugar for a long period of time oftentimes produce something called ketone bodies, which you can smell on the breath in the form of acetone. It's a kind of a sweet smell. And that's one of the things that's used as a sign of diabetes, and also a sugary urine. So you can test that on a test strip. They used to, hundreds of years ago, actually taste the urine to diagnose diabetes. They don't recommend doing that, but you can buy a test strip at the pharmacy that picks up glucose in your urine and test that way as well. So these are all signs and symptoms. By the way, a symptom is something you feel, and a sign is something you measure. So a symptom will be something like thirst, and ketone breath, or sweet breath, or glucose in the urine that you'd measure on a test strip would be a sign. But these are signs and symptoms of both type 1 and type 2 diabetes, because they're signs of hyperglycemia. We don't usually see any of these show up in pre-diabetes. And truthfully, we don't see hardly any of these show up in type 2 diabetes either, because most people with type 2 diabetes don't have really, really high blood sugar. Unless they just really have not been monitoring their health in any way, and it's spiraled out of control quickly. It can happen, but more commonly, we see people diagnosed with type 2 diabetes or prediabetes with a routine blood test that they might have in their doctor's office, or a finger prick that they might have at their work, a health screening. But there are some other signs and symptoms that we can use that people do experience. One of them is being overweight. Now, not everyone who's overweight has prediabetes or diabetes, and not everyone with prediabetes or type 2 diabetes is overweight. But there is a very large crossover. It's about 70%. So if you are overweight, particularly in the abdomen, if you're a woman who carries a lot of extra fat around the hips or the buttocks, that's less of a risk factor. But if you've got sort of the protruded stomach, or you can feel a lot of extra weight around the midsection, if you were to put a tape measure around your belly button and it's actually wider than your hips, or even as wide as your hips, these are signs of visceral fat or central adiposity, which is associated very strongly with prediabetes and type 2 diabetes. Another one is high blood pressure. When you have insulin resistance, which is the root cause of both prediabetes and type 2 diabetes, you make too much insulin, which causes us to retain fluid in our kidneys. So it drives our blood pressure up. So oftentimes we'll see high blood pressure as an early sign of type 2 diabetes or prediabetes. And then if you have a standard blood test done, there's a test called a lipid panel where you'll see your cholesterol and triglycerides. And if your triglyceride number is over 100, acceptable, by the way, is up to 150 from a cardiovascular perspective. But if it's over 100, that's a sign also that you could be moving towards prediabetes or type 2 diabetes. Again, that would be a sign because it's something we measure, as well as weight. There really aren't any symptoms for type 2 diabetes or prediabetes, much like heart disease. You know, until you develop a heart attack, you may not have any pain or any symptom, but there are some signs. Another one could be like puffiness or inflammation around the face or ankles, again, due to the effects of elevated insulin and insulin resistance. So these are all signs of type 2 diabetes and prediabetes, but the best sign, the one that everyone should be looking at, is a routine blood test that they can get at their doctor's office very simply. Fasting blood test, and their blood sugar should be in the 80s. Between 76 and 92 is the range, but in the 80s, and that's a normal blood sugar. If it's above that fasting, you're on your way towards prediabetes and maybe type 2 diabetes.
Well, we're going to talk a lot more about this in the next segment, which is on testing. So if you're listening into this, make sure to tune in. And Dr. Mowll is running the Beat Diabetes Bootcamp here on Health Bootcamps. We are so super excited, so hope you'll join. And for those who are already part of the bootcamp, we're so excited you're here. And make sure you tune in to the next several video interviews. We'll see you then.